Some people are intimidated going to the dentist, but is there an easier way to treat gum disease? We spoke with Dr. Robert Gregg from Millennium Dental, who gives us the warning signs for gum disease and tells us more about the LANAP protocol procedure that has gone viral.
The classical warning signs are bleeding of the gums, puffiness of the gums. There's probably a subtle warning sign that most people don't pick up on, and it isn't just that it's bad breath, but it's almost like a sulfur or rotten egg smell, and that is a sign of active pathologic bacteria. But also other classic signs are loose teeth and discolored teeth, as well as gums shrinking away from the tooth structure.
We asked Dr. Gregg, what is the standard treatment for gum disease?
The conventional treatment for gum disease today involves scraping the teeth in a process known as deep cleaning. But for patients that need surgery, which constitutes probably half of the patients that go through deep cleanings, involves cutting the gums and stitching them back together. My partner and I, 20 years ago, found the results of that to be unsatisfactory. There was root exposures of the roots of the teeth. There was recession of the gums. There was food impaction as a result of the spaces that resulted. There was sensitivity to hot and to cold and to spicy foods. And typically the results weren't that great. Beginning in 1990, Dr. McCarthy and I began intensely looking at a process using a laser, a specific type of laser that we now call the perilase, for the treatment of gum disease in a no-cut, no-sew, no fear, no pain option to reverse the process and damage of gum disease through regeneration versus amputation.
We asked Dr. Bloore why doctors are coming in for the LANAP protocol training.
The doctors are coming here looking for a better solution for the treatment of periodontal disease. These are doctors who have been frustrated with the results that they are getting with conventional methods. We're seeing relapse over time, and they're more of a resective type of procedure where you lose tissue volume as a result. With LANAP, using the Perilase MVP7, we're able to preserve healthy tissue and regenerate lost tissues as a result of the procedure.
Dr. Gregg explains how this particular laser works.
This particular laser, the perilase, has a wavelength that's attracted to the germs in the gum pocket the way that a microwave is attracted to popcorn in a bag. And it selectively pops the germs like the microwave pops the popcorn, but leaves the bag, and in this case the tissue, unaffected. To illustrate the sensitivity, the specificity of this wavelength for the germs that cause gum disease, we can remove the ink off the business card and not harm the card at all.
Dr. Gregg, tell us about your patient, Corey Evans.
Well, we offer treatment to patients at no charge, and Corey was one that came through our training program for doctors learning the LANAP protocol.
The dentist told me it was a problem that I had with my gums. I had gum disease. Well, they did this great procedure called LANAP, which I had no clue what it was. I just knew that they were going to treat it with a laser as opposed to doing a very painful operation. I heard that this alternative was virtually painless. It's something that can be treated in a matter of hours and that had immediate effects, and it was a great alternative to having a deep scrub. I feel great. My teeth are no longer, my mouth is no longer bleeding. I'm not having any issues. It was a fabulous procedure.
We are in the process of a 5-center university-based study, clinical study, which will be a landmark study. We have just halfway through our second human histology study, and as a result of these undertakings, more and more specialty programs in dental schools are taking notice, wanting to participate as investigators, and also there are postgraduate periodontal programs who are now training their postdoctorate residents in the protocol, and thus we are graduating the first generation of university-based and university-trained periodontists. For more information, you can reach the company's website at www.lanap.com.
Going to the dentist is considered necessary for your complete overall health, so if it's been a while, make an appointment before you have any major gum problems. For the American Health Journal, I'm Lora Windsor.